Welcome to Ulosca channel. Access all nursing practice questions. Patient assessment and health literacy practice questions with answers.
Question 1. What is the best way to assess a patient's understanding of discharge instructions? A. Ask if they have any questions. B. Have them sign the discharge papers. C. Use the teach-back method. D. Provide a printed handout. Which one is the correct answer? The correct answer is C. Use the teach-back method. Explanation. The teach-back method encourages patients to repeat information in their own words. This verifies their understanding and allows the nurse to clarify any misunderstandings before discharge. Question 2. Which is the most appropriate question to assess health literacy? A. What is your highest level of education? B. Do you understand what I told you? C. Do you need help reading medical forms? D. How confident are you filling out health forms by yourself? Which one is the correct answer? The correct answer is D. How confident are you filling out health forms by yourself? Explanation. Asking how confident someone is in filling out forms is a non-judgmental and validated way to assess health literacy without causing shame or discomfort. Question 3. A nurse notices a patient nods during teaching but does not follow instructions later. What is the likely issue? A. Fatigue. B. Language barrier or low health literacy. C. Disrespect. D. Cognitive impairment. Which one is the correct answer? The correct answer is B. Language barrier or low health literacy. Explanation. Patients may nod to appear polite or avoid embarrassment even when they don't understand. This can signal health literacy issues or language barriers that require a different teaching approach. Question 4. Which of the following best supports culturally competent care? A. Learning one language for all patients. B. Using the same care plan for all cultural groups. C. Asking patients about their cultural preferences. D. Avoiding sensitive topics. Which one is the correct answer? The correct answer is C. Asking patients about their cultural preferences. Explanation. Culturally competent care requires understanding each patient's unique background. Asking about cultural beliefs shows respect and allows for personalized, inclusive care planning. Question 5. What is the most accurate method to assess a patient's pain? A. Observe for grimacing. B. Ask family for input. C. Use a standardized pain scale. D. Check vital signs. Which one is the correct answer? The correct answer is C. Use a standardized pain scale. Explanation. Pain is subjective, so using a validated pain scale allows patients to describe their experience directly. Objective signs like vital signs or grimacing may not reflect true pain severity. Question 6. Which behavior by a nurse promotes therapeutic communication? A. Giving advice. B. Using medical terminology. C. Maintaining eye contact and listening actively. D. Changing the subject when the patient is emotional. Which one is the correct answer? The correct answer is C. Maintaining eye contact and listening actively. Explanation. Active listening and appropriate body language like eye contact help build trust and demonstrate genuine interest in the patient's concerns. This supports therapeutic rapport. Question 7. What is the priority when performing a comprehensive health assessment? A. Document findings quickly. B. Ask the patient only yes/no questions. C. Create a comfortable, private environment. D. Begin with the most invasive procedures. Which one is the correct answer? The correct answer is C. Create a comfortable, private environment. Explanation: a private, calm space helps the patient feel safe, which encourages open and honest communication during the health history and examination. Question 8. Which of the following is an example of a closed-ended question? A. Can you describe your pain? B. What brings you in today? C. Are you feeling nauseous? D. How has your appetite been lately? Which one is the correct answer? The correct answer is C. Are you feeling nauseous? Explanation: closed-ended questions typically prompt a yes or no response, which is helpful for clarification but not for gathering detailed information. Are you feeling nauseous is an example of this. Question 9. Why is it important to assess a patient's health literacy level? A. To know how long they can stay in the hospital. B. To provide simple medications. C. To tailor education to improve understanding and outcomes. D. To avoid documentation errors. Which one is the correct answer? The correct answer is C. To tailor education to improve understanding and outcomes. Explanation: understanding health literacy allows nurses to adjust teaching methods and materials so patients can better manage their health, which improves safety and outcomes. Question 10. Which communication strategy is most effective for a patient with low health literacy? A. Speak louder. B. Use medical terms. C. Use plain language and short sentences. D. Skip teaching to avoid confusion. Which one is the correct answer? The correct answer is C. Use plain language and short sentences. Explanation: using plain language helps ensure the patient can understand their condition and treatment plan. Complex medical terms and jargon can confuse or overwhelm patients with low literacy.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.